I'm Mariah Swingle. I am part of Genesis Volunteers in the Warm Handoff program, and I have been volunteering for a couple years. This program is so meaningful to me because I struggled in active addiction for 7 years. I was at my highs, I was at my lows. I took my family through it. April 15, 2017, I got clean. I was always told the only way that I can keep the knowledge that I have today is to give it away. I give it away because I know that whenever I was struggling in active addiction, I didn't know half of what I know today. I'm hoping to help at least one person and give them the hope and the determination that they need to get their life on track. The Worm Handoff, we are a group of community volunteers that come into the emergency room department and help people struggling in active addiction that have just suffered an overdose. We talk with them or the victim's family about recovery options that are in the community and or the surrounding communities of like Lancaster, Licking County, and Coshocton. The main goal whenever we go into the emergency room and talk to the victim is to plant the seed that recovery is possible, that we have been there or we have seen our family members struggling and have been there and want to just help them get out of the horrible course of active addiction. The Worm Handoff helps the overdose victims by giving them the community resources that they didn't know was readily available for them. It gives them all the detox options because a lot of people don't understand that there's more ways to detox than just one. They also don't understand that there's inpatient and outpatient options. You don't have to be in a rehab. You can be in part of groups and stuff like that, or you can just do the rooms and not be part of a facility and just attempt recovery on your own. A lot of people do not believe that there's different pathways to recovery, and that is what we want to show them, is that everybody's recovery is different. The Worm Handoff is initiated whenever it is going through the discharge process. The nurse will come up and ask the patient if they would like to talk to somebody in the Worm Handoff, and they go over a little brief description that it's just people in recovery or that have history with recovery will come in and go over the community resource guide and just give them different options for recovery. They choose yes or no, and they sign a release form, and then that is when we get the phone call. Our crucial timing, we try to get there as soon as they come out of their overdose. Whenever they're still in that fearful state of, I just overdosed, I just needed Narcan to come back. I've never personally overdosed, but I know people that have, and that is whenever they're most fearful. That is whenever they want the help because they realize how bad their addiction is. The Worm Handoff helps family members by giving them the resources as well. There's Al-Anon meetings and friends and family meetings listed in that you can go to have somebody else to listen to talk to that has been in that position. If you have a son, daughter, cousin, whatever it is, struggling in active addiction. Addiction is not just a self-disease, it is a whole family disease. The family members are almost drug into it just as much as the person that is using, so they go through it just as much. If you'd like to become a volunteer, you need at least 1 year clean or sobriety time, or have a family member or have some type of history with addiction. Go online to Genesis website and fill out a volunteer application. Whenever that is done, a manager will contact you. After that, she'll set you up with me and I will get you on the schedule. My experiences in this and the most rewarding things that I've ever gotten from it is just seeing the addict actually change their life. Getting that little light back in their eye whenever you're talking to them, whenever they're in the ER room. Knowing that they're actually coming to their senses for that little bit of time, that is rewarding. Knowing that they trust you enough to open up to you about what caused them to use that much, to cause them to overdose, makes you feel good. You get that security of, this person trusts me. This person may not have anybody, but they trust me. I'm giving them hope. I'm giving them confidence that they can succeed in this as long as they put their best foot forward. If you would like information on obtaining the Worm Handoff Community Resource Guide, you can come into the ED, message somebody on Facebook, the Worm Handoff or the Genesis page, or contact the Drug Free Muskegon volunteer.